Welcome to our channel, Medicine World. In this episode, we will discuss on anti-ulcerant Rabeprazole, therapeutic class proton pump inhibitor. Let's start. Keep watching. Rabeprazole is indicated in healing of active duodenal ulcers, healing of active benign gastric ulcers, alleviating symptoms of erosive or ulcerative gastroesophageal reflux disease GERD, maintenance therapy for long-term management of GERD, providing symptomatic relief for moderate to very severe cases of gastroesophageal reflux disease, symptomatic GERD, treating Zollinger-Ellison syndrome. When used in combination with appropriate antibacterial therapies, it aids in the eradication of Helicobacter pylori in patients with peptic ulcer disease. Now we will learn about how Rabeprazole work. Mechanism of action of Rabeprazole involves in getting absorbed into the parietal cells of the stomach, which are the cells that are responsible for secreting hydrochloric acid. At this point, Rabeprazole is inactive. It is a prodrug. In the acidic environment of the parietal cells, it turns into active sulfonamide form. Here, acid secretion is mediated by the energy-dependent acid pumps, called hydrogen-potassium ATPase. Active sulfonamide form of Rabeprazole inhibits this hydrogen-potassium ATPase, resulting to decrease hydrochloric acid secretion in stomach. Now we will know about how proton pump inhibitor inhibits hydrogen potassium ATPase. The gastric hydrogen potassium ATPase mediates the transport of potassium ions in the extracellular fluid into the cell, while intracellular hydrogen ions are simultaneously pumped out of the cell against a high concentration gradient to complete ion transport and gastric acid secretion. Hydrogen potassium ATPase activity is stimulated by inflammatory and other factors by the bacterium Helicobacter pylori, leading to excessive gastric acid secretion and GERD. This is the mechanism targeted by PPI therapy. Unique feature of Rabeprazole is its capacity of inhibiting acid secretion involves its activation in relatively low acidic environment in stomach compared to other PPI. The pKa value of Rabeprazole is around 5.0. That means pH at which 50% of the drug becomes positively charged. The pH of gastric acid is 1.5 to 3.5 in the human stomach lumen, a level maintained by the proton pump hydrogen potassium ATPase. It means that it doesn't take a lot of acid to activate Rabeprazole. Thus Rabeprazole shows faster onset of action in acid inhibiting effect. The recommended oral dose for both active duodenal ulcer and active benign gastric ulcer is 20 mg to be taken once daily in the morning. For erosive or ulcerative gastroesophageal reflux disease GERD, the recommended oral dose for this condition is 20 mg to be taken once daily for a period ranging from 4 to 8 weeks. For gastroesophageal reflux disease maintenance, patients can use a maintenance dose of either 20 mg or 10 mg of Rabeprazole once daily, depending on their individual response. In patients without esophagitis and symptomatic GERD, a dose of 10 mg once daily is recommended. If symptom control is not achieved within 4 weeks, further investigation is advised. Once symptoms have resolved, subsequent symptom control can be maintained using an on-demand regimen, where 10 mg is taken once daily as needed. In case of GERD in pediatric patients, 1 to 11 years old, For patients weighing less than 15 kilograms, the recommended dose is 5 milligrams once daily for a duration of 12 weeks, with the option to increase to 10 milligrams if there is an inadequate response. For patients weighing 15 kilograms or more, the recommended dose is 10 milligrams once daily for 12 weeks. For Zollinger-Ellison syndrome, the recommended starting dose for adults is 60 milligrams once a day, depending on individual patient needs. This dose may be increased to 120 milligrams per day. Single daily doses of up to 100 milligrams per day may also be administered. A 120 milligrams dose may require dividing into 2 doses of 60 milligrams each. Patients with Helicobacter pylori infection should undergo eradication therapy. The recommended combination for 7 days is Rabeprazole sodium 20 mg twice daily, clarithromycin 500 mg twice daily, and amoxicillin 1 gram twice daily. Rabeprazole can be administered either before or after a meal. Rabeprazole is generally well tolerated in both short-term and long-term research. Occasionally, it may lead to symptoms like headache, diarrhea, abdominal pain, vomiting, constipation, dry mouth, increased or decreased in appetite, muscle discomfort, drowsiness, or dizziness. Rabeprazole is pregnancy category C drug, as classified by the US FDA. Animal studies have been conducted, showing no indications of fertility issues or harm to the fetus as a result of rabeprazole. Since rabeprazole is likely to be present in human milk, it is crucial to carefully weigh the importance of the medication for the mother when deciding whether to continue nursing or discontinue the drug. Precautions and considerations of rabeprazole. Proton pump inhibitors, especially when used at high doses and for extended durations, greater than 1 year, may slightly increase the risk of fractures in the hip, wrist, and spine, especially in the elderly, or in individuals with other known risk factors. Observational studies suggest potential increase in the overall fracture risk by 10 to 40%. Post-marketing reports have indicated instances of blood disorders, thrombocytopenia and neutropenia. Hepatic enzyme abnormalities have been observed in clinical trials and reported post-market authorization. Co-administration of atazanavir with rabeprazole is not recommended. Treatment with proton pump inhibitors, including rabeprazole, may potentially elevate the risk of gastrointestinal infections like Salmonella, Campylobacter, and Clostridium difficile. Severe cases of hypomagnesemia have been reported in patients using PPIs like rabeprazole for 3 months or more, often for a year. Serious symptoms such as fatigue, tetany, delirium, convulsions, dizziness, and ventricular arrhythmia may occur, although they can develop gradually and go unnoticed. In most affected patients, hypomagnesemia improved with magnesium replacement, and discontinuation of the PPI is recorded. For patients anticipated to have prolonged treatment, or who take PPIs alongside medications that may cause hypomagnesemia, such as diuretics, healthcare professionals should consider measuring magnesium levels before initiating PPI treatment and periodically throughout treatment. Rabeprazole, like all acid-blocking medications, may also reduce the absorption of vitamin B12. Proton pump inhibitors have been linked to Very rare cases of subacute cutaneous lupus erythematosus, SCLE, if lesions appear, particularly in sun-exposed areas of the skin, and are accompanied by joint pain, the patient should promptly seek medical attention. Bangladeshi brand of Rabeprazole are Phoenix, tablet, enteric-coated 20 mg, Opsinine Pharma, Xarel, tablet, enteric-coated 20 mg, Ibn Sina Pharma, Asifix, capsule, delayed release 20 mg, Bigzimco Pharma, Perisol, tablet, enteric-coated 20 mg, ACI Limited, Rob, tablet, enteric-coated 20 mg, Arista Pharma, Phoenix, sprinkle capsule 10 mg, Opsinine Pharma. Innovator brand, Acipix, Iscion Corporation, Woodcliff Lake, USA. If you like our video, please subscribe our channel Medicine World, and push the bell icon for getting more videos regarding medicine. Thanks for watching, stay with us.